One of the biggest fears I hear from women considering breast surgery is this: what are the scars going to look like? And that fear is completely understandable, but it's also often much worse in imagination than in reality. Today, I want to show you what scarring really looks like after breast surgery, where scars are placed, and why most women tell me afterward that the scars are not nearly as big of a concern as they expected. I'm Dr. Dimitri Koumanis at Saratoga Springs Plastic Surgery, and I have this conversation in almost every consultation. My goal is always to be honest and realistic, because when patients understand the truth about scarring, they feel much more confident moving forward. Let's start with breast augmentation alone. In most cases, the incision is placed in the inframammary fold, the natural crease underneath the breast. This location is chosen very intentionally because it allows excellent access for precise implant placement, and just as importantly, the scar is naturally hidden by the breast fold itself. When you're standing, the scar is typically not visible, even in swimwear or lingerie. It's well concealed in the fold. Why the scars are different when a mastopexy is needed. When a breast lift or mastopexy is needed, the incision pattern changes. That's because a lift reshapes the breast and repositions the nipple, not just adds volume. To do that properly, additional incisions are required, and this is something we discuss very carefully during the consultation. What are the typical mastopexy scar patterns? In a mastopexy, scars usually include a scar around the areola and nipple, a vertical scar from the areola down to the breast crease, and in some cases, a scar along the inframammary fold. So what do the scars actually look like over time? Another important thing to understand is that scars change over time. Early on, they can appear pink or slightly firm. That's normal. Over months, they typically fade, soften, and become much less noticeable. Scar care, sun protection, and following postoperative instructions all play a role in how scars heal. So, women rarely complain about scars. This may surprise you, but scars are rarely what patients focus on after surgery. Once healing is complete, most women are far more focused on how their breasts look in clothing and their shape, and how they feel in their body, and how their confidence has improved. In fact, many patients tell me how they would make the same decision again without hesitation, scars included, because the improvement in shape, position, and self-confidence far outweighs the presence of scars. If you're considering a breast surgery and want an honest discussion about scars, results, and what's right for your body, schedule a consultation with me, Dr. Dimitri Koumanis, at Saratoga Springs Plastic Surgery. We're here to guide you through every detail so there are no surprises.